Hello, so this is chapter 9 of Concepts of Chemical Dependence, Cocaine Misuse and Cocaine Use Disorder. A brief history of cocaine. A member of the plant species Erythrioxan cocoa thrive at higher elevations of the Andes Mountains. Chewing leaves or drinking a form of brewed tea is common in South America, was commonly used in the Inca Empire, has been used as a treatment for depression as well as a narcotic withdrawal symptoms. Cocaine in the U.S. history. The temperance drink called Coca-Cola, classified as a narcotic in 1914, fell out of favor in the early to mid-1900s, but embraced in 1970s and 1980s by a new generation of users for its euphoric effects. By the mid-1980s, cocaine distribution and sales in the United States had become the 7th largest industry of its time, with an estimated $21 billion a year in profits. Crack cocaine was developed for smoking, now 50% of the cocaine market in the United States. Current medical uses for cocaine. Commonly used as a topical analgesic for procedures involving the ear, nose, throat, rectum, and vagina, because it blocks the movement of sodium ions into neurons, can disturb the transmission of pain messages to the brain. Administered topically, effective within 1 minute, and lasts as long as 2 hours, generally has been replaced by newer, safer compounds. Scope of the problem of cocaine use disorder. Between 0.3 and 0.4% of the world's population have used cocaine in the last year. In the United States, adults between 18 and 25 years of age are 3 times as likely to use cocaine as any other age group. Contrary to mass media campaigns, cocaine is not automatically addictive. Perhaps 15% of those who begin to use cocaine will ultimately become addicted, and 28% become regular users. Pharmacology of cocaine. When snorted or injected, effects are short-lived, lasting only about 30 to 90 minutes. Cocaine forces the release of dopamine, affecting the brain's reward center. Tolerance to euphoria develops quickly, leading to dangerous methods to get more effective. Cocaine abusers are known to become depressed after its use. Drug interactions involving cocaine. There has been little research into cocaine pharmacology interactions. Abusers may turn to other chemicals to control the unwanted side effects of their cocaine use. Using cocaine and alcohol at the same time may be life-threatening for a number of reasons. It is not uncommon for cocaine abusers to use both cocaine and a narcotic together. And then in quotations it says speedballing, because that's what it's referred to when you do that. Methods of cocaine misuse, 1 of 4. Snorting, injection, smoking, and sublingual ingestion. Insufflation, quote-unquote, snorting began in 1903. Those who snort cocaine usually arrange the powder on a piece of glass in a thin line. 1 gram of cocaine will usually yield around 30 lines of cocaine. Only about 60% of the cocaine inhaled this way is absorbed, because it is a vasoconstrictor, which makes it even more difficult to abuse in this way. Biotransformation results in 70 to 80% of snorted cocaine not reaching the brain. Intravenous cocaine administration. It is possible to mix the cocaine powder with water and inject it. Intravenously administered, cocaine reaches the brain in under 30 seconds, and virtually all of the injected cocaine will be absorbed into the user's body. Sublingual cocaine misuse. An unknown percentage of the cocaine is absorbed in this way. Rectal cocaine misuse. It is popular among some groups, such as male homosexuals, may provide some analgesic relief from painful sexual practices. Cocaine smoking. Historical evidence suggests cocaine was smoked as far back as 3000 BCE, and smoking resurfaced in the late 1800s when cocoa cigarettes were used to treat hay fever and opioid addiction. Recreational cocaine smoking did not become popular until the mid-1980s, freebasing, and crack was introduced at this time. Smoking crack has all but replaced freebasing. Subjective effects of misused cocaine. Several factors influence the subjective experience of cocaine abuse. The individual's expectations, the dose and purity, the psychological effects. Tolerance develops rapidly, which can lead to massive amounts of usage, quote-unquote coke run, followed by depression that elevated to suicidal levels. Complications of cocaine misuse and cocaine use disorder. 107. Cocaine abuse is a factor in 40 to 50% of all deaths associated with illicit drug use, and it leads to physical addiction within 1 year among 6% of people who use it. Respiratory system problems, chest pain, cough, and damages to the lungs. Observed increase in the number of fatal asthma cases. Crack lung and ammonothorax. Snorters may experience sore throat, inflamed sinuses, bleeding from the sinuses, hoarseness, and a breakdown of the cartilage in the nose. Cardiovascular system damage. Cocaine misuse leads to the buildup of plaque in the coronary arteries of abusers 18 to 45 years of age. Cocaine results in several coronary symptoms, including severe hypertension, coronary artery dissection, and sudden cardiac death. Cocaine has been found to be directly toxic to the muscle tissue of the heart and interferes with cardiac electric activity. Digestive system damage may cause liver damage, other bowel issues, including decreased gastric motility, perforation of the bowel, and bowel ischemia. Cocaine misuse and CNS damage causes a reduction in cerebral blood flow in at least 50% of those who abuse it. Cognitive skill deficiency and increased risk of stroke. Eleptonic may promote the development of seizures, interferes with the process of body temperature regulation. Malignant hyperthermia may alter the blood-brain barrier, allowing HIV-1 to enter the brain. Cocaine's effects on emotions and perceptions. May experience some degree of depression and or anxiety and increase the risk of homicide and suicide. Can exacerbate symptoms of Tourette syndrome and tardive dyskinesia. May help develop hallucinations, including formication. Drug-induced psychosis similar to that seen in schizophrenia, quote-unquote coke paranoia. And cocaine withdrawal. May experience deep depression within 15 minutes after last use. Fatigue, vivid and intense dreams, sleep disorders, both insomnia and hypersomnia, anorexia and psychomotor agitation or retardation, occult insomnia, sleeping less than one realizes, associated with relapse. So that's it for this video. Thanks for listening.